Hi, good evening all of you. Hope you are able to see the screen. Hi, good evening all of you. Hope you are able to see the screen. Hope you are able to view me and you are able to get my voice. You are able to listen me. Please confirm. Thank you. Thank you so much for the confirmation. And let us discuss on our today's topic. It's a good auditing practices. See, you may be, the auditor. I agree with you. But what are the good practices in the audits that we will discuss today? So basically, this training is for the auditors who are doing the audits for third-party audits or who are conducting the self-inspection or internal audits. For that people, this is a training, and this training will helpful for all these people. So let us start with our discussion without wasting time. So this is the overview, or you can say the agenda of the today's training session. So understanding and importance of the audit. So the point is why we should have the training on good auditing practices. The reason is nowadays I have observed that the auditing activity become the monotonous. It is not useful for either the auditing sites or the suppliers, or who are for which customer the audits are conducted. So the point here is we need to understand the good auditing practices which will be helpful both for the customer for which you are doing the audit as a third party auditor, or the auditee also, so that they can improve in their systems. So that is the purpose of today's training session, because see, I have audited more than 500 sites till date, and I found that and I along with my along with me, I took so many times the co-auditors also. I found that when the co-auditors are performing the audit and all, they have the monotonous things. Means the report of one vendor will be exactly similar to the report of the another vendor. So both two different audit reports of two different sites will be similar. Even the observations also, they keep in mind that okay, I need to give this observation, let me check that. They prepare a checkpoint, and if they will check, do you have this? No, and they give the observation. Due to that, even the observations of multiple sites are found, multiple sites are found the same type of observations. So my point is, okay, you give the observations, you prepare the audit report, but the audit report also should be different from each other, and also the observation you have to identify from the different sites. So that is the reason this training is very, very important to all of you. During this discussion, we will discuss about the evaluation of auditing site based on the quality risk management. What happened that many companies, they need to do the audits of maybe 50 or 60 sites. They are doing the audits in-house. They have their own audit teams. But then the point is, they have to prioritize that which site need to be audited first, which site need to be audited later on. So that prioritization should be done based on the risk-based approach. How you should do that prioritization, that also we will discuss during our today's session. We will discuss about the value-added auditing techniques. Basically, we discuss about the auditing. So auditing is not only the fault finding. Auditing is identifying the non-conformity. I agree with you, but it should not be a fault finding exercise. So how we can use that auditing as a value-added auditing? For example, in some cases you need to do the gap audit, you need to do the mock audits before the audit, you need to do the for cause audits, you need to do the due diligence audits. So when you are doing this type of audits, how the value-added auditing techniques will helpful, that also we will discuss today. Of course, the next point is how to save the prestigious audit time, because for auditor, if you are the auditor, you will know that the auditor will have the very little time or very specific time. So you need to utilize your time in a very optimal way. So how you can save your time and how you can utilize your prestigious audit time, that we will discuss. We will discuss about the good practices while auditing facility for data integrity and data review. So how you should review the data, how you should review the data integrity compliance requirements, or how you should evaluate that data integrity and data review in the facility or the organization, that we will discuss. Training and qualification of staff. This is very simple thing. Training is a mandatory for all the companies. You are aware, I am also aware, everyone is aware about this. Training is important. But the point is, what specifically we should look into the training. What activity we should do while review of the training. What type of document we should evaluate. What type of training we should evaluate. That we are going to discuss during evaluation of the training and qualification of a staff. While auditing same site, how to ensure the different audit strategies. Basically what happened in most of the companies, there is a team called global quality audit team, or they have a corporate quality audit team, or the cross-functional team who is doing the periodic audit of the same facility, or there are the third-party auditors who audits the site for multiple times. Even I told that I have audited more than 500 sites, and during my tenure, so many sites are audited 2 times, or some sites are audited 3 times also. But remember that when you are auditing the same site again and again, your strategy should be different. So how you should audit the same sites in a different way, different thoughts, and a different strategy you can make, that we will discuss while auditing the same site again and again. The next point is, when we are auditing, this major point we forget, and that is the reason this point I took it, and that point is related to the auditing for regulatory communications in case of serious non-conformity. So basically when you are auditing and you identify some serious non-conformity, so you need to evaluate whether they have communicated to the regulatory agencies or not. For example, if you identify the out of specification result at a long-term condition, and you come to know that the product itself is failing, there is no any analytical error, the product itself is failing, product is not complying up to the shelf life, recommended shelf life, and product is already in the market, so the point is whether it is communicated to the regulatory agency or not. That is very important, because all the regulatory agencies focus on this aspect, and that is the reason I touch upon this point also. And after this we will have the vote of thanks and then question and answer session. So I would like to request you that whatever questions you have, you can put in the chat box. Your some basic questions, or your some questions related to the voice and all may be answered immediately by my colleague. But if any technical questions are there, you put in your chat box or comment section. I prefer that you put your questions in the comment section, because after completion of this training, the chat box gets closed. So a couple of times I faced this problem, that when I was replying to your questions on chat box was closed and you may not able to access the chat box. So what I suggest, you can put your questions in the comment section, so that from your questions and my answers, it will be learning to the other team members or other members of the people who are coming in our channel, and they can learn from your questions and my answers. Okay, so please put your questions. I will answer your queries at the end of this session. So let us start with this for today's discussion. And before going ahead, this is my short CV. I hope you know my name. My name is Hitendra Kumar Shah. I am a CJMP compliance consultant. I am a trainer, and I am the auditor from NADH plus GXP Compliance Services. This is my brief CV. Already I told you that I audited more than 500 sites and trained more than maybe 5,000 or 10,000 candidates till date. And this is the brief CV about the audits faced and analytical background and computerized system support and all. I work during my tenure in Indian as well as multinational companies. I work in Sun Pharma. I started my career with Sun Pharma. Then I work in Blue Cross Laboratories. I work in Alembic. I work in Zydus Cadila. I work in the US Vitamins, and then I moved to some multinational group where I work in AstraZeneca, then Sanofi and Mylan, and now I am an independent compliance consultant, CGMP trainer and auditor from NADH plus GXP Compliance Services, and conducting the training sessions under this YouTube channel, Hitendra Kumar Shah. So I request you, if you are visiting the first time, just check it. If you have not subscribe the YouTube channel, please subscribe the YouTube channel so that all the training sessions you will get notifications. I am conducting the training on every Sunday now, every Sunday at evening 8 o'clock as per Indian time. I am conducting the free training sessions. So I want to put here some disclaimer. So it is a big thing, it is a formality, so I just put here. The main point is, you please consider this as a education purpose or learning purpose, and there are some references are given. So wherever the references are given, you can refer the current version of the guidelines. That is the disclaimer, and you have to apply your thought process when you want to implement in your organization, because each organization is having a different facilities, different controls, different procedures. So you cannot straight away follow what I am going to discuss during this session. Of course, you can use this as a learning and you can apply suitable way in your organization, this learning. Okay, so now with this, let us start our actual discussion on today's topic with the good auditing practices. And the first point I want to discuss is a risk-based approach versus value-added auditing technique. Many people get confused about this, that why risk-based approach, and if I am doing risk-based approach, then why value-added auditing techniques? See, basically the risk-based approach, I want to clear one point very clear. When you are performing the risk assessment, it will not give you authority to skip any audit. You are getting my point? When you are doing the risk assessment, it will not give authority to skip any audit. The risk assessment or risk-based approach will help you just to prioritize the audits, because you need to do a lot of audits. So it is not practically possible for you to do the audits at a time. So how you prioritize the audits, that we will discuss under the risk-based approach. While the value-added auditing technique will be how you can add value to the auditing by doing the audit, and also how you can add value to the audit report and how it will be helpful for the company for which you are doing this audit. So these are the two different things, and hope you understood the difference. And don't worry, I am going to discuss the same thing now again in the next slides. So let us start with the risk-based approach, and then I will discuss about the value-added auditing techniques, and then we will discuss about the next content as per the agenda. So the scope of quality risk management in audits. So the general risk management includes risk approach to audit scheduling. So already I told you that if there are so many audits, you have the limited auditors, so it is practically not possible for you to do the audits at a time. So you have to schedule the audit, So how you should schedule the audit? Based on the risk-based approach. Second, risk approach to conduct the audit. So scheduling the audit, I will have a further discussion on the next slides. Don't worry about that. Please be with me, because this training session I have prepared on the basis of my personal experience of auditing multiple sites and whole my experience I gained during my tenure. And also I collected some references from different guideline references also, so that also I will be sharing with you. So please be with me up to the end of this session, because this is very, very important session. I put lot of efforts in collecting all the information. Okay, so you will not get all the information under one head unless and until you refer this whole complete video. So the risk-based approach for audit scheduling I will discuss in the next slides. Don't worry about that. The next is risk approach to conduct an audit. This is very, very important, because you cannot audit all the things in a limited time. You cannot audit all the things in a limited time. So The point is you have to perform the audit based on the risk-based approach. You have to take some samples. So where you need to do deep dive the audit, where you need to do the deep dive investigations, where you need to put more focus on specific documentation, where you need to put more focus on specific validation or qualification, that all should be based on the risk-based approach. And how? I will give the example of this. Okay, risk-based approach for conducting the audit. Simple example I will give you, you will understand in a better way. Okay, suppose the company is having electronic documentation, right? Most of the pharma companies are now electronic documentation. At least the chromatographic systems are connected with the server and electronic data is stored, generated and stored. So the point here is many people just focus on validation is there, okay, then SOP is there, privileges are there, that's fine, it is okay. Whoever or any company who is performing the using the electronic data will have the computer systems validation and respective SOPs. The point here is what you have to evaluate, whether this whole system is Part 11 compliant. Now, how you should evaluate? That system need to be audited independently, not only by the same vendor who is supplying you the electronic computerized system, So it has to be independently audited so that the auditor will evaluate whole system, whole controls, available training, privileges control, data migration, data storage, data backup, data restoration, so many things, desktop control, so many things are there. Whole way, that third party auditor or maybe your experts can audit, and then they can ensure that whether it is a Part 11 compliant. So whether you have the audit report of your computerized system to ensure that it is Part 11 compliant or not. So this way you need to put an approach when you are doing the audit, because the point is why you use a computerized system to control the data integrity, issues. Now, if you implement the computerized system but you could not implement the respective controls, then your purpose is not solved. So that is the reason when you are doing the audit, you have to put focus on this approach. I am just giving an example, you can understand in this way. Risk approach to overseas manufacturer. So any overseas manufacturers are there. So how you can perform the risk-based approach for auditing the overseas manufacturer? So that also I will give an example. So again, I told you that risk assessment does not mean that you will perform the risk assessment and you will give the rating that low and then no audit is required. This is practically not acceptable. This is technically not acceptable. This is absolutely wrong. Risk assessment, I already told you that will only help you to prioritize the audit, but it will not give you authority to skip any audit. So how you have to perform the risk-based approach to the overseas manufacturer. So that we will discuss in the next slides when we will discuss about the different accreditations and all. So this way, that way you will able to categorize the manufacturers. And the next point is, anything is missing? Yes, there are a lot of things are missing. When I am writing here, anything is missing with respect to the risk-based approach, there are so many things are missing. So for example, you have to focus on, when you are evaluating, you need to evaluate the mirror. Many people think about that auditing means only the lens, lens-based activity, but no. When you are auditing, you need to evaluate the mirror strategy, not the lens strategy. Lens strategy is okay, traditional lens strategy is there. That means deep dive evaluation, deep dive in depth. But the mirror strategy means, what is you are seeing, whether it is a practice or it is just presented to you during the audit. So that way, and there are so many things are there with respect to the controls on data integrity, controls on the documentations, control on the how the people are responding to the auditor, how they are considering audit as very it is important or not, you know, how what is the approach of the auditee, whether they are focused on the quality or they are not focused on the quality. That all, you know, points you need to evaluate when you are performing the you know, the risk-based approach for the auditing. Okay, so this is what the scope of risk-based approach for the audit. So now let us discuss about the audit scheduling, so that you will understand, you know, with this, you know, you will understand that how the risk-based approach can be followed. So I have taken this example as an example in the next slide, so that you will have the better understanding to schedule the audit on the basis of a risk-based approach. So there are basically, you know, the wide range of products. You go to the slide, like some are the prescription drugs, some are the OTC drugs, some are the complementary medicine. Basically this complementary medicine terminology under Australian guideline. So that is the reason I use this terminology. Some are APIs, some are sterile or non-sterile. Again, some are having a specific risk, some are the potent molecules, you know, so many different wide range of products are there. So the point is, you have to evaluate potential for quality defects across all types. So when you evaluate all different types of products, you need to evaluate the potential for quality defects across all types, and potential to cause harm varies according to the type. How? I will give an example, you will understand in a better way. Suppose the facility is having a two different blocks. One is manufacturing for a general product, and one is manufacturing for the potent molecules. So what are the contamination control concepts are followed? CCC, I call it as a triple C, 3C approach, contamination control concept. How they ensure that contamination is not possible for potent to non-potent molecules, or sometimes, you know, under the same category of a potent molecule, for example, like oncology product. So in oncology product also there are different categories of the product, you know. So there also the risks are there. Some oncology products are directly acting on the cell, some are not directly acting on the cell. So there are also the different cytotoxic molecules and non-cytotoxics and all. So many you know, subcategorizations are there under onco products also. So that way also you need to evaluate with respect to the risk-based approach. So, and based on that, you have to identify that what type of product, what type of facility, whether the facility is manufacturing only general product facility, or the facility is manufacturing the sterile products, or whether the product facility is having the general as well as the beta-lactam or penicillin products. So that way you need to evaluate and identify the risk, where the risk is more or where the possibility of a potential to cause a harm is more, and based on that you put on higher priority, and that way you can that approach you can consider during the audit scheduling. Hope you are getting my point. Further, I am again requesting you, if you have any question, you can put in the comment section, so that I will reply to you after completion of this training session. And please be with me, because you know this is very important. You will not get this content anywhere else. So now I have given one example as a risk rating. So based on this is an example, okay, this is not a final one. So you can rate that high, medium, low risk. And I gave some example like, you know, sterile medicines including sterile API will be associated with the high risk. Potent non-sterile medicine but a potent molecules like hormones or antibiotics, steroids are under the high risk. Non-sterile medicines including the herbals may be the medium risk. You know, homeopathic minerals or vitamins may be at the low risk. So that way you can just think of that. It's just an example I put here, may not be exactly as per your company's procedures and practices, but this way you can put some guidance in your SOP. That is what my point here is. You know, this way you can put some provision so that it will help in your SOP. And second point is risk-based approach is, you know, sometime what happen, you may not able to do the audit as per the schedule, because it depends on, you know, so many parameters. It depends on the availability of the auditee and auditor, and so many parameters are there. So most of the time what happened, you could not audit as per the recommended date. You cross that date, and for that you should raise a deviation. You should follow the deviation procedure. So when you raise a deviation, the risk approach will help you to evaluate the risk, that how much risk is there. You may delay the audit by 3 months or 4 months, but whether the delay will impact on any risk, whether I am compromising any risk, so that risk evaluation will help you as an additional justification with the deviation report. That is what I want to explain you, and this type of example I presented in this slide, which you can put in your which you can put in your training auditing SOP. Hope you got my point. So this is just an example, but this way, whatever the molecules you are handling, what type of audits or what type of suppliers you are auditing, you can make a table and you can put in your SOP. Okay. Now the next thought with respect to the different type of manufacturer. One is what, when we are evaluating the risk-based approach, we evaluated the type of products manufactured, right? Now we will evaluate that what type of manufacturer is, what is the size of the manufacturer, how many manufacturing sites that they have in the same campus, what are the range of the product that site is manufacturing, how many number of employees. Now you will ask, what is its use? Very important, human is a major source of non-conformance. Human is a major source of non-conformance. So if there are more number of employees, then possibility of errors will be more. Okay, so that is the reason I put here. Steps of manufacturing, if the multiple steps of manufacturing are there, that means manufacturing process is a complex, and you need to put more focus in manufacturing process during auditing that site. So complexity, if complexity is there, whether there is automation or not, GMP knowledge of the people, location of the site. So location of the site also plays a very important role. If the site is at a very remote location where nearby there is no any support with respect to the pharma companies and all, so there is a possibility that the people working over there, they may not have the adequate GMP knowledge, or their GMP knowledge will not be suitable with respect to the activities they are performing. So when you are auditing that type of site, you need to evaluate with respect to the training and the GMP awareness of the people working over there. Varying levels of GMP compliance, that is what I told you. So hope you understood from this point, that how you can schedule the audit based on these things. And that is the reason, you can ask before audit, you can ask the site master file and basic documents, so that based on that you will evaluate that whether you need to audit on priority, or whether you need to audit on the next priority. So that way it can help you for scheduling the audit by following the risk-based approach. Hope this point is clear to all of you. The next point is what, the information or knowledge about that site. For example, compliance history, recalls, complaints, changes. So these things, you have to get the information before the audit, so that you can schedule it more better. For example, if the site is having a import alert or the warning letter, then you need to be very much cautious. Now many people speak about that warning letters with respect to the company warning letters and all, but the main point is that warning letter is given based on some non-conformity. So if you go through the observation, nobody can say that it is not a non-conformity. So FDA inspector will focus on non-conformity and will give the observation. So when you are auditing the site, and when that non-conformity is related to the same plant or same product or the same process or similar type of equipments, then you need to ensure that the CAPA need to be implemented thoroughly. Recall, if there may be some recall, then you need to think on top priority. If there are multiple complaints, then again you need to give on a top priority. The very important thing is changes, and the changes of a key people, because the key people quality always from the top. So the point is, when the key people changes, when the key people changes in the organization, the culture gets disturbed, and that can lead to the non-conformity or the generation of the product defects. So the point is, when there are the changes in the key peoples, you have to evaluate that is there any impact on the the routine controls, routine operations or not. Internal information like dossier or evaluation and all. So if you are auditing for some companies as a third party auditor, and if you have the dossier, so you can verify whether the dossier information and the exact information followed in the plant is correct or not. So that way also you can evaluate. External intelligence, you can have sometime external intelligence also, that this particular site is having some product failures, or maybe the recalls, or maybe the fill alert reports, or you can evaluate based on the external intelligence. And very important last point, but not the least of course, but very important, I just collected these points to discuss with you. The very important this point is the results of testing. So what happened most of the time, when you audit the facility as a auditor, that means you are the customer for that auditing. So most of the time the product which is supplied to you, it is tested in your facility, or you test it in the external approved laboratory. So if there is a variations in the results, or if there are multiple failures of the results, then you can put that site on the top for audits. So that way you can schedule the audit by considering these aspects also. And this is what I am discussing, is when you perform the risk-based approach to schedule the audit, you can consider all these points when you are performing the risk assessment for that site. Okay, and then based on the risk assessment, you categorize the companies based on their compliance level. Maybe I gave this example, so in bracket you can see EX means example. You can make similar type of example in your SOP, so that you can easily follow that practice. So I took this example as a general thing. You can have a different categorization of the sites. I categorize here as a A1, A2, A3 and unacceptable. So A1 means good compliance, A2 means satisfactory compliance, A3 means basic compliance. So basic compliance is there, not satisfactory, but basic level compliance is there, and based on that you can put some acceptance criteria. So I just gave a general thing because there is no any guideline, but I just put a general idea that good compliance means what, there is no critical observation, there is no major deficiency or major observations, and other observations are less than 10 number. Satisfactory compliance, 1 to 5 major deficiencies, and other observations are more than 10, and there is no critical observation. Basic compliance means, more than 5 major deficiencies, no critical observations, and unacceptable means 1 or more critical observations and many major observations. So this way you can just put a thought, and you can because what happened when you are preparing the risk-based approach, you will perform the risk assessment, then you need to categorize the sites based on their risk, and then based on that you have to give some solution, that what is your action plan. Action plan is important based on the risk assessment, right? So this way you can put the action plan. So if it is good compliance, then you can extend by 3 months or maybe 6 months, and if it is satisfactory compliance, then you can make a choice as per the risk level of the site. Hope you got my point. So this is an example I put here to make you aware that how you can perform the risk assessment of the site, and based on the risk assessment, how you can categorize or you can schedule the audits. So once you do this risk assessment, and this way you can make a risk category, And with respect to the GMP compliance rating, so I already told you that A1, A2, A3 and unacceptable, you can put in this type of table, and you put risk category as high, medium and low, and then you put the number, risk priority number. Hope you know the risk assessment. I am not going to discuss here about the risk assessment. Already I have conducted a brief training on the risk assessment, the revised guideline R1. If you wish, I will share this guideline link in the I button. So above, at the top there is the I button. You can click that I button and you will get that. You will access that risk assessment training also. Okay. So this way you can categorize the sites under different risk category as high, medium, low based on the different risk as A1, A2, A3 and unacceptable category. You can decide at your end, you can decide L1, L2, L3 level of the sites, you decide, but I just made in a simple way. So it's your choice how you can implement. But the thought, I just want to share this thought. So hope this thought or the concept is understood at your end. Okay. Now, when you are scheduling the audit, you have to keep some controls. You need to control what you can control. There, some things are under your control, some things are not under your control, some are out of your control. So what is under your control? Under your control is the audit frequency. So you can revise the audit frequency, you can extend the audit frequency, or you can reduce even the audit frequency based on the risk. So the risk assessment should be used only not to extend the audit frequency, but sometime if you identify that risk is low, you need to do the audit before the frequency also. You can reduce the auditing frequency for specific site. Okay. Audit duration, you can evaluate the audit durations. If you feel that risk is high, you need to do the audit for 2 days or 3 days. If you feel that audit risk is low, even you can do the audit in 1 day also. So that way you can evaluate the audit duration. So if you need, suppose a 4 days audit, for example, if it is a mock audit, you need to do the audit for 4 or 5 days, but the audit is not ready to give 4 or 5 days complete period, then you can take a help of a co-auditor so that you can convert that audit duration in a man days, audit man days. So that way you can make a use of 2 or multiple auditors so that you can cover all the points during the mock audit or for cause audit or due diligence audits, or in case of risk is high for third party audits, that time also you can take help of a co-auditor. Size of audit team including specialist. So if you have a specialist and if your audit team is broad, then the planning is under your control. So you some points where you are taking some subject matter experts or some specialist, so some specific points you can give to that specialist. For example, if suppose you are going for audit and you are a co-auditor or the lead auditor, co-auditor or is from microbiology background, so the microbiology activity can be given to the responsibility can be given to that microbiologist as auditor, so that auditor will focus on that microbiology aspect. So that way you can make a use of this. Okay. Audit notice is again under your control. Announced versus unannounced audits. So most of the time, unannounced audits you can do on locally. So this is basically very, very important when you are performing the self inspections or internal audits, or you are a third party auditors, or you are a third party auditor who is auditing the contract manufacturing sites periodically. So when you are auditing the same contract manufacturing sites, or when you are visiting periodically multiple times, then the auditee gets confidence on auditor that they know that what auditor is going to look into that. So that is the reason in this case, you can have even the unannounced audits also. So surprise audits you can do. This is again under your control. Yes, unannounced audit you can do in other locations also, but it requires a travel plan and all. So most of the time it is not possible, but yes, sometime if you are going to audit for one site and in the same locality, if another site is there, then you can audit and consider as the unannounced audit. But sometimes the vendor may not ready for the unannounced audit, but yes, if you are taking care of the contract manufacturing sites and you are auditing your contract manufacturing sites, then definitely they will ready to support you for unannounced audit. So anytime you can visit their site and you can evaluate the compliance level. Okay, the audit plan, again, it is under your control. So what point you need to focus, what point you need to evaluate, and how much time you need to spend on all this activity, that is again under your control. So this is what, you know, the point you need to remember, that what is under your control as a auditor. Hope you got my point. Now I want to discuss about the value added auditing techniques. So basically, when we discuss about the value added auditing technique, it indicates that how you can add value by auditing the site. Now in both ways, addition of value to the auditee level or the company level where you are auditing the sites, auditee site, and also the addition of the value at the your client level or customer level, or for which you are performing the audit. So both way you should able to add the value. So first is, let us understand about the dosages, like injectables or OSD or liquid orals, you know. So when you are auditing the the different type of formulations, then you need to know that what is the key aspect or key possibility of harm to the patient due to the failure of a product. For example, injectables, okay, you know that, it may possibility of contamination, and you can evaluate that contamination control concepts and all. OSD, in OSD you need to evaluate that the permitted daily exposure value for all the molecules, and what is the possibility of a very low PD value per product contaminating to the next product. So that way you can evaluate. Or you can evaluate, the liquid orals, how liquid orals can be contaminated. Liquid oral mostly contains rich in sugar, so mostly they are getting contaminated with the fungus and all. So how they are protected from the organisms, or sometimes it is contaminated with the pseudomonas also, pseudomonas organism. So that way you can think of that. Similar way you can put a thought for APIs, but sometimes in API more sensitive is the impurities in the API. So that way you need to put a focus on the API auditing. So this way you can think of that. So same way I discuss about the hormone or higher OEB product or onco product. Third very important point is the benchmarking. So when you are doing the audit, you need to do the benchmarking also. For example, suppose there are two sites supplying the same product to you. Two sites supplying the same product to you. One site is having all the operation manual, everything is manual, but other side it is having the most of the operations under automations, and also the quality management system is also managed through the automations. So very important thing is, when you are dealing with the automation, and if that computerized systems are validated and audited by the third party for part 11 compliant, then definitely the possibility of the manipulation is low. Now tell me, which site you will prefer? You will prefer the site where there is a automation. So that way you can evaluate the benchmarking while performing the value added auditing. And when you are doing the benchmarking, you cannot say that that company is following this automation, you need to follow. No. What you have to do as an auditor, you have to identify some falsification of the data, manipulation of the data, like the document control. There may be some, you will identify some observation on document control, you will find some problem in the retrieval of the loose formats or loose sheets, and then you can tell to that auditee, see, this can lead to the potential data integrity risk. So better way, you need to implement the automation. That way you can add value to the organization. So benchmarking is under your mind as an auditor, But you cannot say that auditing side that X company or X site follows this practice, you also follow this practice. You cannot say like this, right? But you can identify with respect to the existing practice, you can identify the non-conformity, and then you can guide them that why don't you use this practice, this process, so that they can improve in their processes and practices. So this is called a benchmarking practices. The next value-added auditing technique includes, the actual practices followed. So when you are auditing for value addition, you need to evaluate whether the actual practice is followed or not. I have seen most of the self-inspection or internal audit reports, because it is a mandatory one checkpoint of a third-party audits to check the self-inspection or internal audit report. But of course that our report is not shared because it is confidential, but with the help of the auditee you can just ask how many observations are there. We are not interested in the type of observation, but I am more interested during audit is how many observations. And surprisingly there will be one observation. So audit will be done for whole one day by 3 or 4 cross-functional team members, and how many observations identified? 1. That is also recommendation. This is practically not possible. That means actual practices are not being followed and not being recorded. So that way you can evaluate. So how you can evaluate? You can just challenge the people. Okay, clean in front of me. Let me see how much time it takes. That way you can challenge, and you will come to know that in front of you as an auditor, for cleaning that equipment, it took about 6 to 7 hours, and that also with the help of 2 people. But when you see in the logbook about the cleaning, so it will be cleaned by only 1 person, and the cleaning is done within 2 hours. When you check the cleaning performed during cleaning validation, that time also it is cleaned in 2.5 hours. That indicates that the actual practices are not followed during cleaning validation as well as during the routine changeovers. So that way you can evaluate the actual practices are followed or not. Records and data, of course, whatever the records are generated or the data is created, that how it is maintained, how it is controlled, that you can evaluate it. Automation versus manual process. So already I discussed about the automation versus manual processes. Refer the citations or observations. When you are auditing, you need to refer about the current trend of the inspectors. What are the citations or observations of the current inspectors? So the point is, the inspector has not given the observation to that specific auditee, okay, but currently it is observed that, suppose I have given the example of out of specification. We observe that most of the time inspector focuses on the the out of specification results, and that also the OS which is related to the laboratory error, okay, so which is related to the laboratory error OS. That means you prove that there is a OS and you prove that there is a laboratory error, there is no product failure, and you release the batch into the market. So the inspectors are interested in this type of OS, okay. So the point here is, you can use that type of thoughts when you are auditing, so that this type of thought will be delivered to the auditee and they can also think of that. You got my point? So that way you can evaluate with respect to the you can support the auditee for the value addition. Evaluation of possible intentional or unintentional data modification. When you audit it, you need to identify, okay, now there is no there is no non-conformity or failure, but is there any possibility of intentional or unintentional modification or manipulation in future by following the existing quality management system or by following the current controls? And that way also you can put the observations to the auditee. Regularly update internal audit checklist. This is also very, very important. I always request to all of you that when you are the internal auditor, so please regularly update that internal audit checklist. Normally what happened, that checklist is a part of the self-inspection SOP, and it is a part of that, and the SOP is revised once in a 3 years or maybe 2 years as per the company policy. I always recommend that checklist should have the last option as the other. And when you issue the checklist for auditing the specific department, you have to put the additional checkpoints under the other section, and then you can verify. So always remember that to regularly update the internal audit checklist so that you can put more and more focus. And very important thing is management review. When you are auditing, you need to evaluate that what are the changes. I have given the example of management review. So what are the changes are there, improvements are there after management review? How many times the management review is fruitful? Normally management review should not be just the records and attendance sheet and all. No, the management review should be used to escalate some issues with respect to the manpower resources or with respect to the instrument or equipment limitations, so that management can approve the budget or management can recommend to go for some additional upgradation in the systems and the procedures. So that way you need to evaluate what are the changes after management review, so that you will understand that whether the management review is effective or not. If there is no any updations or improvements after management review, it indicates that the management review is a formality and it is just some information is shared to management or just a report is prepared. So that way you can just evaluate, this is management review. I have taken one example, but there are so many things that you can evaluate the effectiveness of that. For example, like in water system, the sanitation. So before sanitation and after sanitation, is there any change in the results? Is there any control? That way you can evaluate. So this way you can just evaluate the controls, and management review is also one of the controls. So you can evaluate the different controls in the organization, and you can evaluate that what are the results or what are the observations before that control and after that control implementation. So that also you can evaluate as a part of value added auditing technique. So that is the reason I hope you understood this now, the value added auditing technique. It will always helpful for you in your organization to improve your auditing skills. Okay. So please bear with me. It will take some more time today because there are a lot of points I need to discuss. So please be with me. If you wish, the recording will be available in the YouTube, but my request is you please go through now, don't leave this session in between. Okay. Saving prestigious audit time, so I will not much discuss here. The very important is pre-audit information. So I always request that get all the pre-audit information with respect to the SOP index, with respect to site master file, with respect to the some accreditations copy, so that what happen, list of computerized system you can get it from the site, so that you will come to know that what type of accreditations they have, then what is the study location, site location is there, how much time you will require to travel there. Based on the site master file you will get this information. You will get the SOP index in advance, so that when you will audit you will not waste your time in writing the SOP title. You can just write the SOP number, and when you prepare the report you can refer that SOP index and you can put the SOP title there. So that way you can save your time. Then process flow. So you can verify the process flow. During the process flow, at which stage the site is using the recovered solvent, whether the recovered solvent is purchased from outside or it is manufactured in-house. Because what happens if suppose the recovered solvent is purchased from outside, so the point is from which company they are purchasing that recovered solvent, and suppose that company is manufacturing let us say the pesticides, and during pesticide manufacturing the solvent is used and that solvent is recovered and that solvent is used and that solvent is sold to that auditing site, and the same recovered solvent is used for manufacturing of specific API. So you need to ensure that it should not have the traces of that pesticide. I have faced this example when one of the audit, I conducted one audit in China before of course COVID scenario, and in one of the company we observed this observation. So that is the reason you need to think of that. So the process flow, when you got the process flow, you will come to know, and you will come to know that where you need to put more focus. How is the site master file? It is a generic or the specific one. So most of the time what happens, the site master files are prepared as generic way. Means supplier controls, for example, or material management. So material managements are managed by the warehouse department. Materials are stored systematically. So the general wordings are used, not the specific wordings. So that you need to identify whether the site master file is generic or the specifics, like the materials are received as per the SOP number so and so, title so and so. The materials are stored in the different places by using the computerized system. So this is what specific. The area is clean, as per the procedure with the different frequency. So you will come to know that whether it is a generic or the specific to the site. Specific to the site means what? Again, I am telling you that specific to the site means the site master file should have the references of some SOPs, so that you will come to know that yes, it is specific to the specific site. Company accreditations, of course, based on the accreditations and all, you will come to know that history of the inspections, and develop your own checkpoints prior to the audit. So based on this all document, you prepare your own checklist prior to the audit, and also you prepare a list of documents which you will require to prepare the report, so that you will not waste your time in collecting the information for preparing the report. You will put your more efforts in evaluating the site and evaluating the systems, procedures, practices and controls, and then you write your all the observations and whatever you observed, whatever you reviewed and all. But for audit report preparation, you collect all the information whatever you need as a part of the list of documents, and then you can prepare the audit report. Many people I have seen that one day audit is there for some API. Most of the API sites, they give only 1 day audit. In 1 day audit, they put their whole efforts in preparing the audit report. So they could not put more focus on auditing the site. So that way you can think of that, that way you can think how you can save the prestigious time in auditing the particular site. Hope you got my point, because see, I prepared this based on my experience. You will not find this in any guideline. Okay. Now I want to touch upon the very important is the electronic data auditing. So basically, the data integrity auditing nowadays is a very important, and electronic data is one of that. So when you are auditing any site, you need to evaluate whether the data integrity compliance, data integrity principles are followed or not. So I have considered some parameters here like electronic data auditing, procedural compliance evaluation. Again, for electronic data auditing techniques, I have already taken some 1 hour detailed training session on electronic data auditing. If you want to go through that, you can go through this I button, and you can access that electronic data auditing techniques. A separate training session recorded webinar is there. Procedural compliance evaluation, you can evaluate whether the procedures are followed or not. Evaluate the data governance practices. Audit trail review one electronic data with respect to the other data. Review of electronic data in line with the reported data. Review of data based on weakness in the system. I have considered all these aspects in that training session. Okay, so you can go through that electronic data auditing techniques training session. I'm giving the link of that training in the description also, so you can go through that training. So review of deep dive investigation, business continuity systems or business continuity plan, disaster recovery plans, their effectiveness, traceabilities, practice evaluation, demonstration access, that you can go through this. So see, I am not much focusing on here as a good data integrity auditing here, because already I have taken the detailed discussion on this, and I just want to touch upon here because as it is a part of the auditing techniques, so I am touching this part. Hope you got my point. This is very important with respect to the training and qualification of the staff. What happened, we normally review when we discuss about the training, auditing the training. So what we review, we check the training strategy, training procedure, training calendar, and some people's training record, right? But here the point here is, additionally there are some basic requirements, so you need to check the compliance of that training requirement. For example, one is sufficient training in data integrity principles required to all the staff, including senior management. So the point is, when you are going for audit, check GMP training, you know that it should be given to all the people. Same way, data integrity training also should be given to the across all levels, and also data integrity training for the senior management. So you just check the training record of the senior management, whether senior management is trained on that or not. It is a mandatory requirement of the guideline. MHRA guideline, there is a mandatory requirement of this. A check of continued personal understanding of a good data management practice in the context of protecting the patient, ensuring the maintenance of a working environment, focusing on quality and open reporting of issues. So what type of culture you have, open culture or a closed culture, that also you will come to know. When you are auditing any company, and when the people are hesitant to speak to you, they are always looking at their bosses, that indicate that there is somehow not the open reporting, there is always the closed reporting. That means there is a potential to the hiding the issues. That way you can think of that. A review of consistency of reported data outcome against the raw data entries. The next is, again I am requesting, I think 1 hour is over, so please be with me. I think I will take 10 minutes more. Reviewers. The reviewer should have sufficient knowledge and system access. So the point is, whenever you want to review the electronic data, you tell the reviewer to sit on the system and show that the audit trail review functionality and other things. So you will come to know that whether reviewer is having access, first point, and second, whether the reviewer is reviewing the data routinely or just for the sake of procedure reviewer are designed. That way you will come to know. Validation alone does not necessarily guarantee that records generated are necessarily adequately protected. That is the reason I told you that whatever computerized system you are using, it should be independently audited by the agency, any agency, by the expert, and that audit should ensure a certification that the system is a Part 11 compliant. Nowadays, many computerized system suppliers or the vendors, they only give the Part 11 compliance certificate. It is of no use at all, my dear friends. It is of no use, because you are working in a manufacturing company and you are telling that your product is good. But how you can tell unless and until it is audited by the independently audited and evaluated by the agency, maybe US FDA, EU or WHO, any other agency independently. Same way, the vendor who is developing the software or computerized system, the same vendor cannot claim that it is a Part 11 compliant. So it has to be independently evaluated and then should be claimed as a Part 11 compliant, because only validation cannot ensure that you are free from data integrity risk. Hope you got my point. Sorry. Okay, because the validation should be supplemented along with the appropriate administrative and the physical controls, and of course training and education to the people. So that is the reason I am recommending to you for auditing independently your all computerized systems. Okay, this is one important point with respect to the possibility or probability of the errors and mitigation plans, and you have to identify that where is the possibility of errors, and there are some points I have listed, like human interventions. So wherever there are the human interventions, always remember there will be possibility of error and you have to identify. Poor organization controls. So organization implemented the good computerized systems and all, but there is no any control on the desktop, or the organization itself is not having a control on the team, no more focus on the quality. So definitely there will be possibility of the errors. poor data review, and more dependency on the validation. That means that, oh, my system is validated, so no need to review or no need too much focus on this. So this type of thoughts you need to evaluate during the audit. Focus on short-term plan as well as the long-term plan. So whether the facility where you are auditing, you need to evaluate whether the site is having the strategy to have a short-term action plan as well as the long-term action plan or not. Limited use of access control functionality like administrative role, quality versus IT. No historical information regarding user access. Access control applied to only application software and not the operating systems or desktop. So this type of points you will come to know that there is a potential risk or probability of the errors. Hope you got my point. If you have any questions, again I am requesting to put in the comment section so that I will revert back to you. There are, I think, last 2-3 slides are pending. So different audit strategies. Already I told during my agenda or the training session that how you should audit the same site or how you are doing the internal auditing of the same sites. So the first is checklist. So when you are doing the checklist, so always remember that don't write the checklist as complies or not complies. You have to write that what you reviewed during the audit. For example, suppose in the checklist it is mentioned that review of BMR. So you can just, you don't write only the complies. You have to write that what is the product name, what is the batch number is reviewed. Okay, during visit to the production. So you can just, you don't write that, okay, no, you should write that during visit to the production, which product was under manufacturing, in which equipment, what is the batch number, whether the online entries are there, whether the batch record, logbooks are filled or not, whether the people are following the good practices, they are following the GMP or not. So that way you have to write it. Not only, you should not write only the complies or not complies. Review and record the review details. Follow back to move process or hopping process. So normally what happen? Third point I am discussing. Second point is very clear, review and record the review details. Third point is follow back or move process or hopping process. So normally what happened, from how you start the audit, you start the audit from the raw material receipt and then manufacturing, packing, laboratory, and then finished goods stores, right? No, if you are doing the audit repeatedly same site, you go on the back flow, you visit the first finished goods stores, and from there you go to the back, or you go on hopping, like after introductory presentation, directly you tell that, okay, let us go to utilities, or directly you go to the quality control laboratory, and then suddenly you go to the packaging activity. So that way you can follow the hopping process. Review key documents like periodic review, updates on QRM. So periodic review of the document. So when you are doing the periodic review, what are the changes you are making, that you need to focus. So always remember, when you are periodically reviewing, there should be some changes, there should be some improvements. If there is no any change, then it indicates that just a minute. So there are no changes in the periodic review. It indicates that the review is not done. Review is not done properly. That way you can think of that. Evaluate changes since last inspection and controls. Check that what are the changes are made since last inspection, and you focus on that last changes, and what are the controls. So sometimes what happened, they implement a change, but due to that change it may lead to some other creation of any other problems. So you identify that. Evaluate positive effects after last management review meeting. That point already I discussed. Whether the company has implemented any automations, that also you need to think of that when you have a different auditing strategy. Okay. Now I was discussing about the regulatory communication. So if there are some issues, you identify, you verify whether the regulatory communications are there. If you are auditing any for cause audit, you need to evaluate that what type of regulatory communications are there. So for FDA, in case of FDA, you need to raise a field alert report. and as per the guideline you need to raise the fill alert report within 3 days of receiving the information about the significant quality problem with respect to the distributed drug. Okay, I am somewhat fast, but you know it is just theoretical, so I am not much discussing here. So many people think that let me first identify the root cause, then I will take the kappa, then I will inform to FDA. No, when you identify that the quality defect in the product and the product is already in the market, you immediately should raise the initial FAR, initial fill alert report, as per the requirement of a 314.81B, and then you can further update that initial fill alert report with the follow-up FAR. And when you take all the actions, you identify the root cause and all, then you can share the final FAR. So that should be the practice should be followed. This is for the US. Why I am telling? Because many people not complying this, and it can lead to a critical category of the observation. Okay, and in case of EMA, they have given the template, defective product report template. You should review an acknowledgement in the 4 hours. So if you inform them, then in the working hours, then to EMA, then EMA will revert to you in 4 hours, and you can contact to these numbers also to inform to the defective products and all. You can share this information through the emails or even the numbers displayed, or even there is a template is given, that template you can fill up and you can share to the EMA. And even the interim reports are there, then you can send to this email ID. Even you can share on this email ID about all the product defects and all information about the product defect which are in the market, that you can communicate through this email ID also. Hope you got this point and you go through this slide. If you have any questions now, please put your questions in the comment section. I will revert back to you one by one, so please be with me for some time. Thank you so much. And of course, don't forget to subscribe this channel if you are first time visitor to the site, to this channel, and also please share this to your colleagues so that they also can learn from this free session. Thank you so much, and ensure all time compliance. Thank you so much. And now I am stopping my discussion or training, and I will reply to all your queries or questions. Thank you so much.